In the musculoskeletal system, you have to observe the functional movements for each of the major joints, and also we have to perform the techniques and the maneuvers if it is needed, and also observe any inflammatory and also the trauma. Hi, what is your name and what is your concern here? Any symptoms do you have like pain? Okay, then we will proceed to the physical examination of musculoskeletal system. Is it okay with you? Would you like to open your shirt and is it okay with you? Okay, so we'll proceed to the physical examination of musculoskeletal system. With the completion of the good hand hygiene, now you are ready to the physical examination of musculoskeletal system. First of all, inspect the shoulders anteriorly, any bony deformities, something like this, and also the inspect scapula and muscles. Palpate the sternoclavicular joint, tracing the clavicle with your fingers laterally. Now, palpate the bony of the spine. Now also palpate the acromial joint. And then now palpate the cricoid process of the scapula, and also palpate the greater tubercle and the bicep tendon in the groove to check the any tenderness. Now ask the patient to lift the humerus to the posterior. Now palpate the bursas and also underlying palpate the sits muscles. Sit muscles are supraspinatus, infraspinatus, teres major and the subscapularis. Inspect the elbow including the lateral and the medial epicondyles and also the olecranon process and also the extensor surface of the ulna. Now palpate the now palpate the medial and the lateral epicondyles and also the olecranon process and note that any swelling, tenderness and effusion and any other displacements etc. Now test for the supination and the pronation of the elbows. Turn the palm up and down. And also assess the range of the motion of the elbows by doing flexion and the extension of the elbow. Observe the patient movements and the motion of the hands when he is talking with you. Inspect the wrist and the hands, and also note any swelling deformities in the wrist and the hands. In the palm, note the thickening of the tendons. Now palpate the inter metacarpal phalangeal joint. Now palpate the radius and the ulna. Now palpate the 8 carpal bones. And now start palpating the anatomical snuff box. Now start palpating the interphalangeal joint. Note any swelling, bugginess and any enlargement. To assess the range of motion of hands, ask the patient to do the flexion and the extension with the hands. And also ask the patient to continue with the abduction and the adduction. If any wrist pain suggesting the carpal tunnel syndrome, test sensation by assessing the by assessing the carpal tunnel syndrome test sensation by assessing the medial nerve pulp by the index finger and the ulnar nerve of the fifth finger and the radial nerve in the dorsal web space of the thumb. Ask the patient to hold your fingers to test the hand strength and ask the patient to squeeze as hard as he can. Now let's test the wrist pain. Ask the patient to grab his thumb inside the palm and squeeze and make note of the wrist pain with the extension of the wrist towards the midline and the older deviation. When the patient in a supine position, ask the patient to lay down in the supine position and inspect the knees that any deformities are present. Now palpate the suprapatellar pouch. Note any swelling is there. Palpate the tibia femoral joint and note any irregular bony ridges are found there. Palpate the lateral femoral condyle and also palpate the lateral collateral ligament. And also palpate the medial femoral condyle and also palpate the medial collateral ligament. To assess the range of the movement, ask the patient to lift the leg until its range of movement. Test the internal and the external rotation of the knee. Ask the patient to swing the leg into the midline and the lateral line. Patient should be in supine and the knee is flexed and the muscle relaxed. Sweep medially, recess joint upwards such as a fluid is displaced medial side, and also sweep the femur until the patella pouch, and we will see the bulge sign here. To assess the swelling in the knee joint, push your hand from the femur until you reach the patella pouch, and other hand same at the stop. On the process, place your finger on the patella and see whether it's floating. To conduct this test, patient should lie on the supine position with the test of the knee and flexed. Rotate the medial lead of the tibia and bring the knee into the extension. You have to perform this with a couple of times. And now the same process, rotate the tibia laterally and bring the knee in the extension, and also do with the couple of times. Ask the patient to lie in the supine and lift the thigh at 30 degrees. Push medially knee and pull laterally to the ankle. Ask the same position to the patient. Push laterally knee and pull medially to the ankle. Knee and thigh is to be flexed 90 degrees, and place your hands on the knees medially and draw the tibia forward and observe if it is slightly forward like a drawer. In this test, place one hand at the femur and the other hand at the tibia. Pull tibia forward and the femur backward, and then estimate the degree of forward excursion in this. As same as the ACL position, push the tibia posterior and observe the degree of the backward movement under femur.